Welcome to the audience and the panelists. Thank you for making time to join the webinar today. The webinar is about transforming national mental health services. At the very outset, I'd like to invite everyone to please add your names, the organization from where you are and the country in the chat group so that we can greet and know who is on this webinar today. I am Bharti Patel. I am the National Executive Director of the South African Federation for Mental Health. The SAFMH is a national mental health advocacy and awareness civil society organization. We work with government, civil society organizations, both national and international, and we try to transform national mental health services, mostly from a biomedical approach to one that is human rights focused, so that we can make mental health a reality for all. I am going to ask our panelists today to introduce themselves, and I'm going to call upon Alison Schafer to introduce.
Thanks, Bharti. Hi, everyone, and welcome to the call. I'm Ali Schafer. I work for WHO's Department of Mental Health and Substance Use, and I lead the implementation of WHO's Special Initiative for Mental Health.
Thanks, Alison. Hadil.
Hello, everyone, and thank you so much. It's my pleasure to be with you today. So I'm Hadil Alfar. I'm the National Mental Health Officer, and I work for WHO Jordan office. We are also implementing the Special Initiative for Mental Health.
Thank you very much. Lidiia.
Hello, everyone. I'm a consultant providing operational support for a Special Initiative for Mental Health.
Thank you very much. We also have a pre-recorded video that we will play for you all later on, and that is from Mika Silangate, who is the Deputy Director for Policy and Partnerships in the Philippines. So thank you, everyone, for your introductions. All webinar participants, please remember to send your questions in the chat group. Share examples of where you are having success or challenges in driving national reforms and any advice you would like from the panel. So in the next session, I am going to be asking our panelists today a round of questions. And we also have two presentations from the World Health Organization. So my first question would go out to Ali Schafer. And I'm going to ask Ali, what is the Special Initiative and what have been some of the key achievements?
Okay. Thank you, Bharti. It's a real pleasure to speak to you all today about WHO's Special Initiative for Mental Health. This here in the first slide is an image that you'll see from a cross-country meeting that we held just last month in Istanbul. And you can see that it involves a lot of people from a lot of places. And this is certainly a massive team effort. So it's my pleasure to speak on behalf of all of these people and everyone that's involved. We all know globally there's many areas of mental health work that's needed in the world, but WHO's Special Initiative for Mental Health is specifically aiming to reduce the massive treatment gap that we see in most low resource settings. Can I grab the next slide, please? We're targeting mental health policies, laws and rights, and the scale up of services, particularly at the primary healthcare levels. Key to this approach is a commitment by WHO to work with countries' ministries of health to work together for at least 5 years. And we want to do this so that we can truly institute some systems level change in the work that we're doing. Next slide. The Special Initiative for Mental Health was officially launched in 2019. And in 2020, we received some financial support to enable us to begin work in what we call 6 early adopter countries. These were Bangladesh, Jordan, Paraguay, the Philippines, Ukraine, and Zimbabwe. And as resources were mobilised, by 2021, we added Ghana and Nepal to our fold, and last year we added Argentina. So we're presently working across 9 countries, although the original goal was to always work across 12. We hope to still reach that at some point. Each country begins their work with a rapid assessment, a basic desk review of the mental health landscape, and a multi-stakeholder design process. And the multi-stakeholders involve governments, multi-sectors, civil society, persons with lived experiences, NGOs, WHO, UN, whoever is engaged in active mental health work in the country at the time. And those design processes establish a 5-year plan for each country. And from those 5-year frameworks, countries prepare annual work plans for activities. So there remains a little element of flexibility in the changing contexts and to meet country needs over that time. Progress in each of the countries is variable. They've each started at different points and are going in slightly different directions and slightly different paces. And they take on slightly different priorities depending on their needs. The next few slides that I'm going to share, there's just 2 more, is to talk about some of the achievements that you asked about, Bharti, around the countries and some of the highlights from each. I need to emphasize that there's like 2 points to every country, and there's far more for every single country. But here's a quick summary. So Argentina is our most recent country. It's still in design phase, but it's very much looking forward to a long-term process of deinstitutionalization. And they're going to look at doing that through increasing access to community-based and primary-based health services, other sectors as well. Bangladesh has made some exciting progress, and there's been a strong focus on government advocacy. Along with Paraguay, both countries have succeeded to advocate for their ministries to actually create a directorate for mental health, which means over time, this will generate much more emphasis on mental health and ensure mental health receives, importantly, national budgets. Different inroads for mental health exist in different countries. Ghana is building on their quality rights work over the years, and they're beginning to focus on the integration of mental health with services in other health conditions. For Jordan, you'll hear more about that from Hedil shortly. They're very active with the Jordanian Nursing Council, and they've offered a means for us to strengthen quality services provided in general hospitals, at the same time as the focus is on growing work at primary healthcare levels to help feed referrals and manage people with mental illness locally. In Nepal, there's been a stronger focus on district level management of mental health services and working to improve the quality of primary healthcare management of people living with mental disorders. So you're probably starting to see a pattern now. There's a bit of a blend of advocacy and primary healthcare focused work as prime strategies. And that's a key way to increase availability of services. Another common pattern that's emerging from our special initiative countries is the work being done before, during, and after emergencies. So in Paraguay, the introduction of online consultations for mental health occurred during COVID-19, and this is an intervention that's going to continue as the country expands their services. In 2022, the Philippines experienced a couple of typhoon emergency responses, and they very much used the existing special initiative work in primary healthcare services to provide services to emergency affected populations and a means for expanding their community level access. Ukraine was the one that naturally has changed shape the most in the past 12 months, sadly being the case. One thing that's been interesting, though, in Ukraine is that the work that they were doing prior to the escalation of hostilities there appears to actually have supported their rapid expansion of services over the past 12 months. And a lot of the special initiative work and the MHPSS in emergency response work in Ukraine have a lot of integration and a lot of similarities. So that's been an interesting case for us in the last 12 months. And last but certainly not least, Zimbabwe has been making some steady progress. They've integrated mental health into their national essential healthcare package. and they've expanded human rights via their quality rights training on the online program and are beginning to roll out primary healthcare services using the MHGAP tool. So let me conclude and just say that's a really tiny snapshot of our Special Initiative for Mental Health work, what it's about, and you can read more on our webpage. But back over to you for the moment, Bharti.
Thank you very much, Alison. That is absolutely, it's so much of information about what the initiative is all about. It's great to have a background. And I think it gives us a very good understanding, about the World Health Organization and the work that is being done across these countries. I want to call upon Hadil. Hadil, maybe you can tell us what has been some of the successes and challenges of integrating mental health into primary healthcare in your country.
Okay, thank you so much. And I actually have prepared some notes to address that. But first, if I would like to give just a quick overview about the context here in Jordan in terms of primary healthcare. So basically, Jordan is committed internationally to achieve UHC, universal health coverage, as part of the UN Sustainable Development Goals. They are one of the signatories of the Salalah Declaration that took place in 2018, reaffirming Jordan's commitment to build health systems that are resilient, that are equitable, and that are sustainable. So this is like the let's say the new commitment and direction for the country. So basically, health systems are provided through the public sector, the private sectors, and also the NGO sector, given that Jordan is a host country of refugee populations throughout the years. So it's a little bit complicated, but let's through this PHC network of services that are managed under the MOH, the Ministry of Health, which is like the main service provider, Jordan has a network of about 600 over 600 of PHCs distributed throughout the kingdom, providing generalized services, providing preventative services, and like the generalized services includes, let's say, maternal, child, and reproductive services, and non-communicable diseases. So in a nutshell, there is a good distribution of primary healthcare centers throughout the kingdom, but there is no much evidence. However, there is no much evidence about the real situation, like the efficient coverage and also let's say the quality of services. So to summarize some of the successes that took place working in mental health with the WHO support, Jordan has been able, to integrate mental health in its services officially. Like it's officially stated in its national policies, in its national action plan document, and there is a clear strategic interventions in the action plan, which has been recently developed under the special initiative efforts that states dictate that mental health should be integrated in the primary healthcare using the MHGAP package tool, the mental health gap action program tool. So and recently there has been really good efforts, a great scale up of training and supervision services. So basically, as of today, we have about 30% of the primary healthcare centers in Jordan providing mental health services. So this is a great, milestone. And recently, last year, there was an official approval of including and integrating the mental health gap action tool in the national training curriculum, the pre-service training curriculum for family physicians. So this provides some kind of sustainable, efforts and long-term, integration of mental health at the national level. So these were some of the successes in terms of integrating in primary healthcare. There has been also integrating in mental health in secondary and tertiary. We have been able to create community mental health centers, inpatient units in general hospitals, but that's a different, topic that I don't want to, maybe discuss today. But it's also important to, highlight some of the challenges as well. There has been a recent PHC assessment that took place last year, and some of the main findings actually revealed that we have some good problems. Some of them range from bypassing PHC was noted as a major problem. There is a general tendency of the population to seek specialist services rather than accessing the PHC for care, including mental health. There has been also noted that we had issues with privacy, the existing referral system is weak, the absence of referral tracking system, it affects the continuity of care. It has been also noted that there is a perceived low trust in the primary healthcare, let's say, workforce, delays occurring due to overcrowding in some facilities, and there are so many, and some of them actually relates to the fact that 75% of the MOH PHCs are rented. So this leads to delays in renovating these facilities and providing maintenance to these facilities. So in a nutshell, generally there has been like some findings saying that 70% of the facilities, the PHC's facilities in Jordan, require expansion to provide some privacy. 45% of these facilities require maintenance, and so on. These are the general kind of challenges, but to address mental health specific related challenges in terms of integrating, mental health programs generally are underfunded. The Directorate of Mental Health does not have a budget, and they rely entirely on us, on WHO, on the international community, on the NGO sector to provide and to support and fund mental health generally. And also training opportunities are limited, and as I said, they are donor dependent. And finally, and this is very important, there is the distribution of the health workforce is not properly, made. So it's the health workforce operating in these PHCs are not distributed according, not to the catchment area and not to the registered patients of that particular facility. This leads to frustration, this leads to overcrowdedness, and eventually to a high turnover of health workforce. And of course, eventually it affects the quality of the care provided by that facility. So I hope that I provided like some good example or some good, illustration of the situation. And I'm happy to receive questions. Thank you.
Thanks, Hadiel. That's quite informative. I think, the kind of challenges that you have posed, I think, many of us experience in various other countries, especially the overcrowding, the issue of trust. So yeah, we can relate to the challenges that you have mentioned, but it's good to know that there are great achievements, because I think as we edge into, we get closer towards accessing mental health services. So thank you for sharing those examples. Up next, we will be sharing a pre-recorded video from the Philippines, and this is in response to a question that was posed to them, is that how has civil society been involved in the special initiative, and what have been some of the benefits and the challenges?
Good day, everyone. I'm Mika Salangi, the Deputy Director for Partnerships and Policy from Mental Health PH, a non-government organization established in the Philippines in 2016 to promote and to protect mental health. We in Mental Health PH are fortunate to be one of the many organizations in WHO Special Initiative invited to participate actively in advancing mental health policy. The highlight of our involvement is during the Department of Health and World Health Organization's design and development of an online course for persons with lived experience. The online course was designed to empower persons with lived experience to be mental health champions and advocates. It was designed for the PWLEs with the PWLEs. Other than that, the other organizations are also involved by the Mental Health Special Initiative in the fields of research, information system, leadership and governance, and community-based mental health services. Having the opportunity to be involved in the special initiative allowed Mental Health PH to align its priorities, initiatives, and work collectively with other stakeholders doing the same. Since the special initiatives design its initiatives like the e-learning course for the PWLE and with the PWLE, it provided an avenue for us to present our needs and concerns moving forward in mental health. Like what we always say, Nothing about us without us. Through the special initiative, our platform to promote, spread awareness, and educate people on mental health were further amplified. We are glad to be able to foster good partnerships with professional organizations, civil society organizations or CSOs, government agencies, and other institutions both here in the Philippines and abroad. But since most of these kinds of partnerships and engagements don't provide financial support to the CSOs, ensuring that these CSOs will still be there until we reach our goal remains a challenge. While we see the benefit of involving the CSOs to the initiative, it has to translate through partnerships and support. Another challenge we believe we could still improve on is in amplifying these initiatives so that more people can know about it and be involved. This further ensures inclusivity and representation from various sectors like the LGBTQIA+ groups, indigenous peoples, patient groups, persons living with HIV, and the like. This can be achieved through partnerships and awareness campaigns. Overall, the involvement of Mental Health PH in the WHO Special Initiative for Mental Health gave us more hope that we will be able to achieve universal health coverage for mental health in the Philippines. We are excited and looking forward to the continued collaboration with the Special Initiative to reach our vision of having a mentally healthy community.
That was an amazing video, and at least we get to hear what is happening in the Philippines. Exciting. And now I will go to Lidiia Lukasevych. And Lidiia, what are some of the key lessons learned and how can they be applied to non-special initiative countries?
Thank you very much. Can I please see my slides? I probably will start and the slides will come up. So late last year, WHO issued a request for proposals to gather some learnings about our work to date in the Special Initiative for Mental Health. And this was undertaken by Queen Margaret University. It involved review of 158 documents provided by WHO relating to special initiative activities across the 9 participating countries and 42 interviews with country-level stakeholders, WHO regional and HQ personnel engaged with the initiative and core donors. Yeah, perfect. Thank you very much. We are aware that we're not able to speak about individual countries. That wasn't the purpose of it. It was rather to take a broad view across 9 countries and see some common themes emerging and some different perspectives. Next slide, please. The midterm learnings showed us that the 4 main achievements of the special initiative to date that appeared across interviews were establishing a platform to address mental health issues at the national level, and this has supported development of key policies and laws for long-term systems transformation. Services has started to expand, though we expect to see more of that in the next few years, since there are countries which just have started their journey with special initiative. And the multi-stakeholder design processes was widely acknowledged as an achievement, but particularly at the country level, which have been critical to getting buy-in for change. The engagement for persons with lived experiences has also been highlighted as a key achievement in these approaches. Next slide, please. One of the most interesting questions that have been asked during this midterm learning was what has contributed, what has been really helpful in terms of driving those achievements, and how these achievements have come about has been the dedicated and continuous work with ministries of health and other senior country level influencers. Every other interview has listed senior country level buy-in is an absolutely key factor behind successes. Having WHO dedicated personnel in each of our country offices has been key, and the explicit planning process, seeing what could be envisioned in 5 years rather than working in a gradual, piecemeal way, has helped all our partners to envision long-term gains. Of course, none of this wouldn't have been possible without financial support from donors, such as NORAD, SDC, USAID, who have made meaningful investments in mental health system strengthening and the slow processes of devolving mental health services, which are so traditionally provided as secondary and tertiary medical levels of care, to the community, local, and primary healthcare levels of care. Next slide, please. It's not all been smooth sailing, though. Some of us have been kept awake many a night with challenges facing this program. For individual countries and across all 9 participating countries. While there were only 4 or 5 key themes for what came out of a discussion, what are the areas of success, here we have a much broader understanding of what the challenges are. Our review summarized these challenges across countries briefly. While we have political buy-in to do something about mental health, getting over the line to make real and significant changes is more difficult. For example, task shifting is a major approach people like in theory, but in practice, many are resistant to such change. This is similar to when we need our ministries to be dedicating their own financial and human resources to mental health. Advocacy is constant, where we need to keep encouraging ministries to fund new staff or to reorganize the terms of references of existing staff, and allowing people opportunity to build their capacity to do more mental health work at the primary levels. Next slide, please. The main framing advice is that although there is a long list of challenges there, it's really best not to pick one challenge and see it as an isolated issue, but rather to see that we are all engaged in systems-wide transformation. And there are 3 key issues that the learning is drawing our attention to. The recommendations from our midterms learning strongly emphasized our need to focus even more on political buy-in, lobbying, and advocacy. This needs to happen from all the directions, including from civil society. We need to focus a bit more on the user experiences and where and how they access services. This feeds back to attracting more political commitment to demonstration need for local level services. And finally, we need to get our numbers in order to demonstrate impact of our work. We would be the first to admit that we very much underestimated the complexity of monitoring and evaluation for the special initiative. And we're committed to trying to resolve some of these information challenges at both programmatic level, but also countries, because we know that numbers talk, and this too will influence these political actions needed for true systems level changes. Next slide, please. And as Ali said, it has been a very, very small part of our special initiative for mental health work. And there's a link to our website where you can read more about our initiative and country-specific work. And also you would be able to find an above-mentioned midterm review as well. For now, it's back over to you.
Thank you so much, Lidiia. That was quite, I think I felt, I could relate, especially, I just like how you put funding under success or achievements. It's great to know that there's funding that's backing the special initiative, because I think that really gives it, motivation, and it gives it confidence to complete some of the goals or achieve some of the goals. So we've heard from our panelists, and I am sure that many of our participants will be putting in their views and sharing with us examples of where you are having success and challenges in driving national reforms, and also add any advice that you would like from the panel. So especially for me, in South Africa, we do have a mental health policy and a strategic action plan, and that is great to have. Our policy was first launched in 2013 all the way to 2020. But the challenge we were having was in terms of implementation, because we found that not many of our government officials, specifically in the provinces, they were not trained on implementation of policy, and that is a huge gap. We also have separation of duty in government from a national to a provincial level, while we find that within our national government, they are responsible for policy development, and it is up to the provincial governments to implement policy. And that's where we feel there's a big disjoint. So as we await our new policy, hopefully soon, we will be focusing on our advocacy initiatives and efforts at provincial government to make sure this time around, in the next 5 years, we see a bit more implementation happening. So right now, I want to invite our panelists to answer a very short question. So let's see. Are there any questions from the audience? Okay, let me just go to the chats. For Ali, are more countries going to be added to the special initiative?
So the original plan was that we would work with 12 countries, which represents 2 countries from each of WHO's 6 regions, and that we would be in time hosting events like this, providing resources on our website and so forth, so that other countries in the regions could benefit from the learnings, the achievements, the pitfalls, etc., of what we're doing. So the idea was that those 12 countries would provide a demonstration of how some level of transformed mental health systems can actually be achieved. Because funding has been realised only gradually, we're currently still only at 9 out of the original 12, and we do hope that we might get 3 more countries to achieve our original 12 that were planned. Having said that, the other 3 countries have not been selected. That's not they're not named or selected in any way, but we would be dependent on additional support for that to happen. And if it went beyond 12, that would be amazing, but I certainly think we just need to take it one step at a time.
Great, thanks, Ali. Hadil, the question to you is, what happens next in Jordan on the special initiative?
We're planning a lot, to be honest, because we want to seize the opportunity. We want to, use the momentum that has been, created with the special initiative work. And I can say that now we have this general agreement throughout through the different, counterparts that they want to do more for mental health. So, and we have the political buy-in. Yet we are still facing many challenges. Like I can name one. We recently, one of our biggest champion, the director for mental health, has retired before her scheduled time, and this caused a lot of confusion and frustration. But at least we know that we are in the right direction. We are hoping specifically for 2023 to expand to scale up image gap, the mental health gap action program, to do more work on training, on supervision. We are partnering with the Jordanian Nursing Council, and there is also a plan to do an investment case for mental health for Jordan for this year. So we can do more. I know it's a great opportunity, and we have this good support whether from the nationals and also the other communities. And we have good engagement also from people with lived experience. So I think it's the right time to do some good reform on mental health for Jordan. Thank you.
Great stuff. Alison, another question that is posed to you is how is the World Health Organization's special initiative, how can they help amplify country-level political commitment, especially increase of national budget for mental health, professional human resources, etc.?
So I'm not sure if you mean to, or if our questioner means to amplify what's being achieved or what's needed. I'll look at both kind of considerations. You'll see from the review of our special initiative that one of the biggest achievements of the special initiative is that it created a platform, or what Hadil just referred to as momentum in the country. So it created a conversation about mental health, of which many stakeholders have started to get on board in each of our 9 countries. So I suppose that would be the platform or the momentum that we can use to promote both needs and achievements. And I think I'd like to reiterate that the associations and persons of lived experience are really key to that. The civil society engagement is what's really important, because they're the people that we ultimately end up wishing and needing to serve and support. And having them actually carry the voice of the need and the voice of achievements and improvements is probably something that's going to have far more impact than, for example, if I was to do that, or even in some cases, politicians. So I would have to say that it's a group effort, but I would say that amplification is a critical role for civil society, whether that's about promoting gains and achievements, or whether that's about also promoting the needs and the resources that might be lacking.
Excellent. Thank you very much. We have another question, and the question is really around as a safe talk trainer with Living Works, the world leaders in suicide prevention training, and the person is on the roadmap to take some of these models to Uganda and Africa at large. So they want to know, how can they engage with the World Health Organization to support these initiatives?
I'm looking at Hadil because I don't know if it's better for Hadil to connect or for me, but I would suggest probably connecting with the country office and the country level WHO. Do you want to delve into that a bit, Hadil?
But if you can please repeat the question again, if they can connect with us regarding the suicide, what?
Yes, I think it's more to be able, how can they engage with the World Health Organization so that they can, support the initiative through their programs, the suicide training programs?
Well, absolutely. Like they are always welcome to approach us at the country office, and we are very happy to discuss and explore what kind of support, or let's say partnership can be potentially made. Yeah,
great.
And Bharti, I'll just add that WHO has multiple strategies and resources available for suicide prevention, and they're available on WHO's website as well. They're all free for download. So there is the possibility to also engage with WHO in the utilization of those resources.
Yeah, I think the resources are quite helpful, because I know even within South Africa, I mean, we always looking for, programs or good practice models so that we could, on a different level. Obviously, there is always a need for funding, but I think through stakeholder engagement, holding hands with government and other partners, one can always engage in conversation with government and find political ambassadors, because I think that's what we struggle with in South Africa, is to find a political leader who has a passion for mental health and to use that person to be able to probably, lift the conversation, to promote mental health in all programs, especially health programs. So I think, that is our learning. And we constantly engaging with our government officials to try and find some way to get a foot in the door. And it helps to be able to constantly look out for high-level meetings where mental health can be, put on the agenda, and ask key questions so that you find more engagement around mental health. Okay, wonderful. I'm just wondering if there are any other questions. I am trying to get through. Okay, there's a question again for Alison. Thank you for the talk and awareness you are providing. How do you see the role of innovation in mental health? Would you be open to collaborating with associations who tackle this?
So innovation is really important, particularly as the evidence for online and remote mental health support is growing. And COVID-19 probably helped us need to speed that up a little bit. So certainly some of those innovations are important. Whether we would partner with other people depends entirely on a different set of conditions, and that would be conditions such as what the evidence base is, what the cross-cultural adaptability to the interventions are, so on and so forth. And the other complication is that it's not WHO that actually chooses the innovations. So it's actually the governments. So this is a point to remind us that WHO is a facilitator mandated to support the Ministry of Health in their delivery of their plans and their priorities. So it's not something that necessarily WHO would say yes or no to, but it is something that we could only do to represent the needs and the desire of the ministries that are ultimately implementing and responsible.
Thanks, Alison. For Lidiia, could you explain more about monitoring and evaluation difficulties you encountered?
Yes, I can. So the difficulty is that the data collection methods and the quality of data varies across countries very much. And we faced some difficulties collecting data for our baseline reports for each country. That countries were either completed last year, or some countries are still completing them this year. So we were lacking that baseline data. Maybe Ali would add something.
Okay. So certainly the quality and the variation of data across countries makes it very difficult for us to say to you definitively that this is how much the whole program has contributed, but we are able to measure that a little more accurately country by country. The other factors that have contributed to this is health information systems are not actually recording or they record different things. So some health information systems, for instance, might record the single person and their identity and the number of times they visit, whereas another health information system might record a new visit every single time somebody attends the services. So actually trying to differentiate the number of people versus the number of visits has been challenging. Differentiating also what constitutes mental health support versus psychosocial support is sometimes a bit tricky as well. And this is because there's so much overlap between the two. So is a person receiving psychosocial support actually receiving mental health treatment, or are they receiving other supports and services that are still critical to their mental health, but does that constitute a treatment or an intervention? So there's definitional issues, there's data quality issues, there's differences across countries. And it's been super challenging for us to determine how we're going to report on all of this in summary for all of the 9 countries. And we think we've started to find a little bit of a way, but I want to say we're testing it this quarter and next quarter before I want to confidently say we've found a way. So I will say, though, it has taken us 18 months to get to this point. So, we attempted to do baselines and we had to leave some time for countries to collect that information. Then we had to do the analysis. We realized it was all a bit skewed and a bit different. And then Ukraine ended up with really, really big numbers all of a sudden because their support through the emergency skewed the data quite a lot. And then that forced us to think about the difference between mental health and psychosocial. Hadil might be able to provide some more challenges around M&E because Jordan is one of our challenging contexts because of the way they record patient information and the information that's available. And then to record things like coverage, you've also got to get down to some of the disorder levels. So we've had to identify a couple of disorders that we would use as so-called tracer disorders that we might be able to then start to assess some coverage. So it's been a really tricky journey, and I think we're getting closer, but I don't think we're 100% there yet.
Hadil, do you want to add?
Yes, I can add to that from the experience because we are living it and we are asked to report to them to the special initiative. And to be honest, although that we are providing, let's say, some good support and we can see that services are provided at a large scale now, but we cannot capture that fully. We don't have the government, the country does not have a well-functioning health information system in place to give us these numbers. And as Lidiia said before, numbers talk. And unless we have this system, we cannot really, we are depending now on individual efforts. Unfortunately, we don't have dedicated M&E staff at the national level working for the government to collect and to capture these numbers. So we are depending on individual ad hoc support, kind of irregular support to collect this information. And usually they are paper-based. So we have to go there, we have to do the phone calls, you have to spend some time and to try to collect as much as possible. And the issue is that there is no consistency. So if you get these numbers for this time frame, it's not guaranteed yet. You are going to get the same numbers for the next, let's say, time interval or period. So this lack of consistency is actually frustrating. But we are gonna work on that. There is some, let's say, promising, let's say, direction in the Ministry of Health now in Jordan. They want to shift to DHIS2. We have recently introduced DHIS2 for some specific areas to pilot, let's say, data warehouse. And we can see that the government is going towards that direction. So if we eventually manage to do the same for mental health, then I think this is going to be very useful. Thank you.
Thank you.
Bharti, can I just add that despite monitoring and evaluation being a massive challenge, it's also actually led to a lot of opportunities. So the mere issue of WHO working with the Ministry of Health to try and get this data has meant that the ministries have started to recognise their lack of data and the role of data in managing mental health and being able to budget for it, being able to supply appropriate medicines, being able to actually manage the referral systems, who's accessing what services, etc. So on the one hand, we are really challenged with this, but it's also providing us a really rich opportunity to have important conversations that might otherwise have not happened with ministries. So I'm trying to look to the positives as well as the challenges.
Great. Thanks for that, Alison. And I think what I'm seeing also in the chat is, people are looking out for possible training opportunities that will come through from your learnings, because I think training on M&E would be a valuable initiative for most countries, guiding governments in terms of what data they should be collecting, as a primary start towards, learning about mental health and the services that are available in countries. So we look forward to that kind of training coming out, possibly from the World Health Organization. One final question, I think, is, and this is for anyone, are there volunteer activities that individuals and communities can participate in to promote awareness of and buy-in for the special initiative in the respective countries? So I think it's talking to, possible awareness programs of the initiatives in the countries that it's taking place in. Anyone?
In every country that we're working with, we are working with associations of persons with lived experience or experts by experience. And some countries have more organisations established than others, and some countries' organisations are more advanced and coordinated than others. So I think one of the most important roles that individuals can play is actually to contribute to those associations. Because when those associations are represented at ministry levels, and when those associations are represented when we're figuring out data, when we're working on improving quality, when we're working on human rights and other types of monitoring, it's easier for us to work with groups than it is to work, or well-organized groups, than it is for us to work with individuals and so forth. So I suppose for individuals, my advice would be to get in contact with some of those associations, and they are available in every country. I know United for Global Mental Health also do a lot of work in this space. So if there's uncertainties, there's lots of people that we can inquire with. And I think that's probably one of the best ways to get involved. Different countries are doing different activities with service user organisations, but all of them have some element of trying to strengthen their capacity in some way so that their engagement is ongoing and continuous.
Great. Thank you. Thank you to our panelists. I think, you've given us a lot of information. And for our audience, your questions are in the chat group, and I'm sure we will be able to respond to your questions individually in the chat as well. We now come to the round of key takeaways, and I will be posing a sentence to our panelists and ask them to complete the sentence, maybe with a short answer to this sentence. So, Alison, maybe we start with you as well. To transform national mental health services, we need to. You are on mute.
I've decided to say, to transform mental health services, we need to include everyone, everywhere. And what I mean by that is we need all the stakeholders engaged, and we need to be reaching people where they're at. We don't need people to be coming to us, we need to be coming to them. So for me, that statement finishes with including everyone, everywhere.
Thanks, Alison. Hadil?
Okay, so I think we need to reallocate resources at all layers of mental health system, of all the mental health levels, to effectively and efficiently reflect the needs of all population.
Great stuff. Can't agree with you more. Lidiia?
I think we need to increase political prioritization and funding for systems level transformation of mental health services, and articulate sustainable and transformed model of care.
Excellent. Thank you. Thank you to you for answering that. For me, I want to say, to transform national mental health services, we need to get all our stakeholders from various government departments, but also including our mental health care users to be involved. So yes, I think, everyone everywhere is doing their bit, and we've had key takeaways. We've had people share their experiences the positives, achievements, as well as the challenges, because those are key learnings in how we are going to improve mental health for everyone. So thank you to our panelists, and the audience for participating in this conversation. Please remember that the next webinar will be on suicide decriminalization. There is a registration link in the chat. Please go and look at the chat. You will find a lot of information. Click on those links and you will be able to register for the next upcoming webinar. I know I have done so already. And this conversation will be continuing on Circle. The link will also be in the chat. And I think people can scroll up and down and see if there are any other information. There's a whole lot of information that has been provided in terms of the various organizations and the initiatives that are taking place in various countries. So please take time, look at the chat. This information will also be sent, the recorded version will be circulated so that you can catch up on the chat and the information that is provided. So thank you very much to everyone for participating, and thank you to our panelists as well. Thank you. Take care.